The FDA says people who switch completely from cigarettes to Zyn nicotine pouches may reduce the risk of diseases like lung cancer, heart disease, and stroke, but the agency still stresses that does not mean these products are safe. So 9 News medical expert Dr. Kohli is joining us now this morning for more on this. I think we should start, as always, at the beginning. Some people may not be familiar with what these nicotine pouches are. Please, can you explain?
Yes, they've come on the shelf now. They're
Yep.
everywhere, as you said, convenience stores, and you can get them really anywhere. So they're these tiny little pouches that are tobacco-free, so different from chewing tobacco, but they have like artificial flavors, sweeteners, and they have plant-based fillers. And you take a little pouch and you put it between your gum line and your lip, and you leave it in there for about 20 minutes to about 60 minutes, so about an hour. Then you take it out and throw it away, and that allows absorption of that nicotine directly into your bloodstream through the oral mucosa. So it's a way to get smokeless nicotine essentially into your bloodstream.
I mean, some people are obviously using them not to quit smoking. They're just using them to get their, their fill, if you will. The American Lung Association is not happy with the FDA's call on this. I mean, the FDA said, hey, they're safer than cigarettes, which makes it sound like a good thing almost, right? But the FDA said, we're appalled. Or pardon me, the Lung Association said, we're appalled by that statement. What are your thoughts?
I am appalled as well, Drew. I mean, I think this is the wrong move by the FDA to even call them safer. Are they safer? Yes, 100% they're safer because they don't have the combustion products that cigarette smoking does. But the problem is when you hear safer, you think safe.
But if they are safer, how else do you describe that?
Do not describe that.
Don't even go down that road.
Do not go down that road. Why does the FDA have to call them safer? This is the problem that I have as a physician because nicotine itself is an addictive substance. In fact, it is as addictive, it's the same category as heroin and cocaine, much more addictive than alcohol and Xanax. And what we're seeing is by calling them safer in an era where we already see almost 2% of middle schoolers and high schoolers are using them. 1 out of 6 who are using them say they're using them every day. And Zyn is the most common one. Now you've taken essentially a drug and marketed it as an oral kind of mint. I mean, it's flavored, it tastes good, you just put it in your mouth, and kids don't realize how addictive it is.
How about this? For the remainder of the segment, we will not refer to them as safer, right? High five right there. Well, in fact, what we can do next is talk about the real health risks. I mean, what are the risks of these pouches?
So nicotine is a drug. It's a cardiac stimulant. It triggers the blood vessels to have inflammation. It increases your heart rate. It increases your blood pressure. And the more nicotine you consume, the more dopamine gets triggered in the brain. Dopamine is that feel-good hormone, right?
Yes.
So it helps that reward system. So you start having cravings. You start becoming cranky if you don't get it. You get withdrawal symptoms. And in fact, what happens over time is a phenomenon called tachyphylaxis, where the more nicotine your brain sees, the more it increases the receptors for nicotine. So you now need more nicotine to get that same dopamine release, that same high that you got from a little bit of nicotine. And we're talking essentially a higher dose of nicotine in these patches than what you would get from cigarettes.
Okay, so again, this is not good news here this morning. We're talking the truth, we're speaking the truth. I do know the FDA has mandated something from Zyn, right? They want them to do something. Can you explain what that something is?
Too little, too late, in my opinion. But essentially what they're saying is, okay, we're going to call it safer. Let you put it out there. We want you to monitor how many kids are now using this, how many middle schoolers and high schoolers report back to us.
How are they going to do that?
Just based on sales and such.
But the individual stores would have to keep track of that.
That's exactly right, yes.
I've seen the person that's checking out sometimes at the store. I don't think they're keeping track of anything.
Well, also they want them to do surveys about perceptions. So they're going to do focus groups and surveys and see how do people perceive this? Do they perceive it as safe? Do they perceive it as innocuous, just like a breath mint or what have you? In my opinion, by that time, you've already gotten many American kids and adolescents addicted to it, not to mention adults too. People who haven't used nicotine in the past may start using it because they think about it like just a little zing and you feel good after you take it. So really, I think this is the wrong move by the FDA, and I wish they had just not called it anything and just said it's a way to wean yourself from cigarettes, and that's how they should have marketed it.
One more thing before I let you go. I should clear up. The clerk that was working yesterday at the Safeway over on Broadway, not too far from the station, was definitely on top of things because
he was paying attention?
I tried to go through the checkout line. I didn't have my wallet on me. I just had my phone to pay with like the Apple Pay. Had a bottle of wine. They're like, I need your ID.
Well,
like,
that's a compliment.
I said, well, I think they have to do it. Then I said, I don't have it on me. It's at home. And they said, well, you can't get the wine. They didn't let me buy the wine, doctor.
Wow. Well, I'm proud of it. So Safeway clerk, we'll make sure to give them some kudos.
Safeway clerk over here on Broadway, not too far from the station. Dr. Kohli, great advice again today. Thanks for coming on the show.